Good afternoon and welcome to this webinar, Enterprise Travel, the Role of Occupational Health and Organizational Resilience. This event brought to you by Security Magazine is sponsored by Everbridge. I'm your moderator, Maria Henriquez, Associate Editor at Security Magazine. Thank you for joining us. Today's presenter is Julianne Kause, Chief Medical Officer and Medical Director at Anvil Group, an Everbridge company. Don't forget to submit your questions, and later in the program, our presenter will address as many as possible. Today's event is being recorded and archived on securitymagazine.com. And now I am excited to turn it over to today's presenter, Dr. Julianne Kause.
Thank you so much, Maria, and thank you also to the organizers for this opportunity to share my passion for travel health. As the slides will be available after this session for downloading, I've packed it with references at the end. And please feel free to pop questions in the chat box during the presentation. So let's get started. Today, I'll give you an overview of the principles underlying travel medicine. Travel-related illnesses and traveling with long-term illnesses, like, for example, diabetes, asthma, and epilepsy, are often poorly understood, and hopefully, by the end of the session, you will have a much greater insight. We'll also consider the fitness to travel and how we assess that, how COVID has changed business travel, and what pre-travel medical screening options are available. So, what is occupational travel medicine and how does it help individual and organizational resilience? Occupational medicine concerns itself with the non-pharmacological, which means no pills, management of ill health in relation to the workplace. And I think traditionally people might have an idea of sort of ergonomics, desk heights, special chairs. And occupational travel health does the same thing, except the work environment is the travel environment. So we look at the influence of work on health and also vice versa of the influence of health on work. And we do this with non-pharmacological, so non-prescribed healthcare measurements to ensure that the workplace, which in this case is the traveling environment, remains as healthy as possible. And the reason this is becoming increasingly important is because that global surveys have shown that 20% of new patients presenting to their primary care physician usually have an occupational component to their illness. And that could be physical or psychological, with musculoskeletal illnesses being the most common. It's also really important to look at this concept from the organization's perspective, because employers are responsible for identifying hazards in the workplace and assessing the risks for all their employees, and that includes business travel, which is an area of occupational travel medicine that has probably been underserviced up to now. In addition, different countries have different legislative frameworks around the management of health and safety at work. Like other security or risk management occupations, occupational travel medicine uses a risk matrix of assessing a hazard and a risk to perform an assessment on the danger of a particular situation. And this is applicable not just in medicine, but I'm sure you'll recognize the sort of pyramid of elimination, substitution, engineering controls, administrative codes, and PPE. Now, PPE obviously has assumed a new meaning during the pandemic, but I'm sure you're relieved to hear that I'm not going to use COVID as an example to talk us through how this pyramid approach is applied to occupational travel medicine. And as in other areas of risk assessment, elimination is always the most effective with a decreasing level of effectiveness going right down to PPE. So let's consider an example. I'd like to introduce you to Angela. Angela is a lucky lady because she has a swimming pool. And one morning she wanted to go for a swim and she noticed a bull shark in her swimming pool. Now, most of you, I assume, will not be familiar with this type of creature. This is what it looks like. So having done some risk and hazards assessment training, Angela assesses the situation using the hierarchy of controls. So she can consider, should she eliminate the bull shark from her pool, and that would eliminate the hazard, or should she avoid the risk by not swimming? Should she substitute the hazard by, for example, replacing the bull shark with another animal? One suggestion that comes to mind is to replace the bull shark with this animal, a small white-tipped reef shark. And that is roughly the size of a goldfish. So that would be an effective substitute and allow her to swim. She could also avoid the risk by swimming somewhere else in her neighbor's pool. She could put an engineering control in to minimize the hazard by building a wall in her pool and stop the shark from swimming near her when she decides to swim. Or she could design a special mouth guard for the shark, which would reduce the risk of her being bitten. And as you can see, each of the steps from elimination, substitution, engineering, administrative controls, or personal protective equipment is less and less effective in controlling the hazard or managing the risk. In particular, wearing shark armor is not something I would want to consider in this situation. And although this is a light-hearted example, it illustrates perfectly the approach we take in occupational travel medicine in order to create personal, individual, and organizational resilience. So let's consider the health and well-being of business travelers. Globally, business travel comprises 14% of all international travel pre-pandemic. And the review of almost 800,000 international trips found that a quarter of them had at least 3 international trips per year, that 17% traveled for at least a month of the year, and that 11% had at least one trip that lasted for more than 30 days. So business travel is therefore a significant proportion of a business traveler's working life. And it's therefore in the best interest of the employers and those who have to assess health and safety of the employees working internationally to consider occupational travel medicine. Companies sending staff overseas are usually expected to cover the costs of providing effective health education, vaccination, and risk mitigation programs. Not only because it is best practice, but also because in many countries, businesses may be legally liable if they don't do so. And the consequences of acquisition of mild temporary illnesses to serious illnesses has a significant impact on the employee, their families, their home life whilst traveling, and also on work colleagues. In addition, it leads to loss of productivity, reputational loss, and financial loss for the individual, for the business, and for the insurer. So, how do business travelers compare to leisure travelers? More business travelers are men. There is usually less time in planning a trip. Business travelers tend not to seek pre-travel medical consultations unless they're obliged to do so by their employer. They're usually shorter periods of travel, and most business travelers stay in hotels, which was obviously considered safe. But in view of political and security developments over the last few years, it is increasingly questionable whether hotels remain the safest form of accommodation to avoid illness and injury. Business travelers tend to travel more in urban areas than rural areas, and as I said earlier, travel multiple times a year. So the occupational traveller may have better control of their environment, have different health-seeking behaviours due to employment requirement, and also better access to medical care whilst overseas, but is usually not focused on their health and well-being because the focus of their trip is to conduct business. And therefore, the area of occupational travel medicine is often neglected by a business traveller. So travel-related illness in general travellers is fairly similar to that of business travellers. Unfortunately, studies have shown that a third of travellers become ill whilst travelling. A large proportion become ill with gastrointestinal problems. And a large proportion of those who become ill need to consult a doctor, usually for a diarrheal or respiratory illness. And this can lead to needing to change travel plans and destination. And the incidence of this depends on the age of the traveller. So unlike many other medical problems, illnesses in travellers are highest in younger people under the age of 40, and particularly in those who are just starting out in their independent travelling careers in their lives. And the greater the climatic and cultural contrast between the traveller's country of origin and the travel destination are, the greater the risk of illness. And this has been shown consistently in different studies over time. So travel-related illness in occupational travellers is very, very similar in proportions. So largely gastrointestinal and respiratory illnesses, 20% requiring medical care, and 1 to 2% requiring early return home. The difference between a leisure traveller and a business traveller appears to be that psychological problems are more prominent. On a different note, a study from the World Bank employees showed that the rate of medical insurance claims from business travellers were much higher from men than from women travellers compared to non-travelling colleagues. But I think that is also related to the fact that more men are business travellers, as I'd shown on an earlier slide. What is interesting, though, that the rates of claims for these World Bank travellers were highest for psychological disorders and then the more physical illnesses already discussed. In a survey of business travellers some time ago, but that's the last survey we've had a few years ago, showed that the disruption in sleep and rest patterns, gastrointestinal problems, and climatic adaptation like sunburn and heat exhaustion contributed considerably to ill health and underperformance whilst travelling. And this needs to be taken very seriously because whilst each of these last 3 points on the slide may appear trivial, they cause a huge amount of personal stress and business disruption. Infectious diseases in travellers I'll want to talk about a little bit more because it is so common and because it affects up to 50% of travellers, which leads to a significant proportion having to change their travel plans, being confined to bed, requiring hospital admission, and again, younger people who might just start out on business travel have higher rates of attack. The most important factor in this is the origin of the traveller, because if they live in a country where infectious diseases are not common, they are more likely to pick up a gastrointestinal infection, and that, of course, is often the country of origin of a business traveller. Until the gut flora has adjusted, the highest risk is during the first few weeks of travel. Other infectious diseases, such as malaria and sexually transmitted diseases, have a significant impact on business travel and are totally preventable in almost all cases. So malaria occurs in 21% of people presenting to their physician with a fever and accounts for 26% of hospitalization for all business travelers. And there's a paradox, because occupational travelers are often well informed about malaria risk, but still comply poorly with preventative measures. So some further thoughts needs to be put into how that can be turned around. Occupational travelers are particularly at high risk of sexually transmitted diseases because often they're young people traveling alone, they're often men, they are going to country where casual sex may not be uncommon, where there's repeated visits to the same region, and falling into habits that may be common practice in the regions visited. Again, a totally preventable illness. Unfortunately, injuries are the most common reason for medical repatriation, and therefore huge expense to the business, the insurance, and often huge personal cost to the traveller. The traffic accidents also account for the majority of deaths of travellers, alongside drowning and murder. Now, fortunately, not many people die whilst travelling, but it is significant, and security advice and health advice can be given to prevent these from happening. And the peak incidence occurs in men under the age of 40. Psychological disorders have gained in understanding and prominence during the last 2 years, since the beginning of the COVID pandemic. And as we learn more and more, we also understand better the importance of managing psychological disorders during travel, because travel may exacerbate or precipitate a variety of psychological disorder. Drug misuse, religious beliefs, and time zone changes are really a common factor in worsening of symptoms in travellers, alongside a medication used for the prevention of malaria called mefloquine. This only occurs in some travellers, but it's important to warn travellers of that when giving a pre-travel consultation. Frequent international travel has been associated with increased insurance claims for psychological illnesses, which led to the research into this area and has shown that family disruption, isolation, because business travellers are often solo travellers, health, and a huge workload were the main stressors of these events. However, it's not all bad news. Good family support, older age, previous overseas experiences, individual characteristic coping skills such as high self-esteem and a strong sense of coherence and purpose are very helpful in preventing this from happening. A little bit more about death during travel. One study suggests that cardiovascular disease, so heart attacks and strokes, are still the most common cause, followed by injuries and accidents. In fact, infections, although very common in travellers, account for few of the deaths. And these patterns are similar in business travellers originating from the United States of America, Australia, and Canada. Because more men are business travellers, more men die overseas and in the older age group. So how can occupational travel medicine help with the care of business travellers? There are 3 approaches we take. The first one is to provide information about the travel, where the person is going, when they're going, and for how long they're going determines the degree of preparation that is required, and specific preparation, for example, vaccination, taking medicine packets, malaria prevention. Also information about the traveller, the current health status, including their past medical history, their past travel history, and current medications influence the advice given to a traveller. And most important, prevention can avoid most of the problems I've discussed before. So primary prevention includes country-specific information and travel-specific information. For example, how to avoid deep vein thrombosis whilst travelling. Secondary prevention involves the management of diseases that can worsen during travel. For example, if an asthmatic travels to an urban destination with high levels of air pollution, it is helpful to know in advance how to mitigate against that and have the appropriate medications to hand. For psychological resilience, self-enhancement techniques are very useful. Tertiary prevention includes the monitoring of chronic illness and its management whilst travelling, and with the improvement of remote medical services, this is making a significant difference to the general health of business travellers. However, the assessment of fitness to travel looks at the stability of long-term medical conditions and the resulting fitness or lack of to cope with the hazards and risk that can be expected with business travel, and the emotional stability and psychological resilience. With business travel, long-distance travel with heavy luggage and prolonged immobility needs to be considered as a travel hazard, and the hazard as the destination, for example, traveling to developing countries, the effects of climate and culture shock can largely be mitigated through good preparation. I will now go through some pre-existing medical conditions to contextualize their importance in business travel and why, even though if somebody is well managed by their general physician whilst not being on business travel, how business travel affects pre-existing medical conditions and how we can mitigate against those deteriorating. And you won't need much medical knowledge, even though I'm using a lot of diseases with specific medical terms, but that's just for guidance. So, cardiovascular disease is still the commonest cause of death of an illness rather than an accident. And recent myocardial infarction, cardiac surgery or stroke may make a business traveller more fatigued for up to a year after the event, even though from an insurance perspective, it is often only weeks later that permission to travel is granted. So it is recommended that an occupational travel health assessment takes place to assess the likelihood of coping with business travel. Blood pressure, whilst well controlled when not on business travel, often deteriorates, and business travellers report very high readings due to the stress of travelling, due to the change of time zones, and therefore either not taking medication or taking medication late, and often due to the change of diet, foods rich in salt, increased alcohol intake make blood pressure worse. That is usually well treated. People who have cardiac pacemakers or implantable defibrillators need specific advice for airport security, so those devices are not disabled. Going on to respiratory disease, there are many chronic respiratory diseases where people might require oxygen, where they might need to take their regular inhalers, and often those people's mobility is limited. And a good way of assessing whether they might manage business travel is to ask whether people can walk 50 meters or climb one flight of stairs without stopping and becoming short of breath. Respiratory diseases are also worsened by travel to areas with high air pollution, and therefore special consideration needs to be given for rescue treatment. There's a general perception that people with epilepsy are not safe to travel. There is, however, no evidence that this is the case. The likelihood of seizures is not going up due to the perceived theoretical risk of stress, jet lag or sleep deprivation. And a review of a recent seizure pattern or hospital admission is useful to establish whether a traveller is stable enough to attend business travel events. People who have an immune system that is not functioning well, either because they don't have a spleen, which is common in many parts of the world, people who have an underlying long-term condition, such as HIV, or people who are currently undergoing chemotherapy or take other immunosuppressant medications, are not visibly at risk and are therefore often overlooked unless they have an assessment from an occupational travel health professional to assess whether business travel is safe for them. Other diseases, such as diabetes, the level of control really determines whether somebody can function during business travel, because there are many complications of diabetes that are contraindications to flying. Ear, nose and throat problems may be very unpleasant for the business traveller and very painful, but are usually not serious enough to prevent business travel and can be treated easily. Psychological problems are often made worse by travelling, as I had detailed earlier, but increased alcohol intake is a significant contributing factor to that. So, how has business travel changed during COVID? More documentation is required. Some countries require health passports. Behaviours have changed. Social distancing, face covering is required. And the perceived personal risk to travel has also changed. And therefore, all elements of travel are now different. At airports, there's a different volume of traffic. Airlines have specific regulations. Cleaning regulations have changed. And public health infrastructure has changed. And the way we conduct some activities have changed. For example, indoor-outdoor dining, indoor-outdoor meetings. I'd like to draw your attention to the traveller's personal risk stratification tools and COVID vulnerability, which takes into account vaccination status, chronological age, underlying medical conditions, allows an individual physician to calculate the vulnerability to COVID-19 for each individual traveller, and therefore allows us to give bespoke advice. And also allows us to give the business advice which risk level they may wish to accept for COVID vulnerability travel to be permitted. Because elements of travel have changed, people with special needs and additional support may need to consider how ground transport has changed, how behaviours in a destination country has changed, how accommodation has changed, because often help that might have been available with luggage is currently not available, because in certain countries there is guidance, for example, not to help with luggage, have significantly changed business travel, but hopefully in a temporary way. And I think, given that it is expected that other viral illnesses will make the rounds globally, this is a good opportunity to test whether our travel preparedness and travel health preparedness is good enough, using COVID as an example. So the best way of preparing a traveller for safe business travel and ensuring that the business gets a resilient model in place is to provide information, education, training toolkits for risk reduction for the business traveller. And whether it's during business travel or in any other places at work, a well-informed, safety-conscious worker is less likely to suffer work-related injury or illness than a worker who is not. And the level of and intensity of health and safety training related to occupational travel medicine is related to the predicted perceived risk. And traditional methods such as leaflets, posters, seminars, quizzes, videos are all useful and should be provided by all levels of the organisation. But an individual risk assessment for each traveller is the cornerstone for successful and risk mitigated travel. And in order to do that, we have developed 3 different work opportunities for business travelers to engage with us. We have a program for the frequent business travelers that focuses on travel-related illnesses and injury and focuses on preparation in behavioral, cultural, and psychological aspects of travel. Compared to the program we offer for the long-term deployee, assignee, expat for short, where management of long-term conditions in a different culture or climate are important, and where it is also important to promote healthy lifestyle prior to the onset of business travel. A third group of people, we offer a different program for our students or young persons going on volunteer placements, because they're actually at highest risk of occupational ill health due to the cultural and behavioral and psychological state young people tend to be in, and that includes homesickness, sexual health, and the perceived freedom of experimenting with drugs and alcohol whilst abroad. And we can mitigate against that through education and through ongoing training whilst these people are traveling or volunteering. So, in conclusion, frequent screening benefits the traveller by providing general information, by ensuring that the traveller remains healthy and resilient and able to perform their role with distinction. It benefits the individual traveller by having an independent, personalised risk assessment that allows them to ask their organisation, their employer, to make workplace adjustments during travel if required. And it also gives the traveller the resources to manage long-term health conditions and to build positive business travel practices. It is hugely important for the organisation because it gives the organisation confidence that periodic individual risk assessments have taken place, that risks have been identified, mitigated or raised, and that appropriate support and preventative measures are in place. That leads to the best health and productivity outcomes with fewer critical incidents, medical evacuations and repatriations, leads to increased financial protection, resilience for the organisation, and a huge reputational and productivity gain. And that concludes my talk. And I thank you very much for listening, and I'd welcome some questions.
Thank you for a great presentation, Dr. Kause. Before we have her address some of the questions that have been submitted throughout the program, I wanted to remind you that we would love your feedback in our webinar survey to help improve our programs. And now for our first question. You mentioned psychological resilience is important during travel. How do you prepare travelers to become more resilient?
Thank you. Excellent question. There are several levels. People who are previously healthy without underlying psychological problems benefit from information and education, and there are a number of different training programs that are certified and internationally recognized, and that includes, for example, mental health first aid training, which is done very similar to physical first aid training, and I'd encourage everyone to do a training course like that because you can stop the psychological bleeding at any time. People who already have psychological problems often try to hide them whilst traveling, and I would recommend the same, that people go to their physician to get their blood pressure pills, that they see their physician prior to business travel to assess how best strengthen their psychological well-being through adjusting medication, through engaging in regular mindful practices, counseling, ensuring that the workload is not overwhelming, and ensuring that organizational support is available, for example, through employee assistance programs. I hope that gives you some ideas of what can be done quickly and constructively.
Okay, thank you. That was very helpful. Another question, given that accidents are the leading cause of death when traveling, can we do more to avoid accidents while traveling internationally?
Thank you. I mean, it is so stressful, and this is what we do for a living, um, to support businesses, families, and colleagues when such a dreadful event happens. So anything we can do to prevent accidents is really, really quite impactful. So the most important aspect of this is to have an individual pre-travel consultation. And that is simple things such as awareness of traffic rules. Is it right or left-hand drive? Individually tailored to the person who is traveling. So they understand how to avoid risk, how to accept different behaviors, and to have individual mitigation strategies. For example, allowing more time to go to a venue, maybe taking a different form of transport than they would in their home country because it is safer, and checking in at regular times and being given the opportunity through the culture of their organization to alert to risk when it is perceived.
Okay, another great question. Do you have any recommendations for strategies to reduce excessive alcohol consumption for company travelers? Trips seem to sometimes give explicit approval to drink to excess, especially on business or social events.
Yeah, and this is a significant global problem, and it's often considered the sort of substance that lubricates the business conversation, facilitates the outcome of a conversation, and has become socially acceptable that, for example, people have alcohol related illnesses or injuries. And the best way to deal with that is to have a educational positive approach of understanding that alcohol is very much part of the business traveling culture, but to suggest practical steps such as no daytime drinking, avoiding spirits, so therefore having lower alcohol content drinks, and considering the number of drinks that are consumed in a business setting, and also reminding travelers that other behaviors such as hydration, the food that is eaten, all impact how alcohol is digested. So the approach through the culture of an organization to changing that through soft measures tends to be effective. The other really effective way of dealing with this is through the pre-travel health questionnaires, where it gets flagged up if a traveler is likely to drink more during business travel, and then delves deeper into structured alcohol questionnaires. And that then allows the opportunity on a individual doctor physician basis to give the appropriate health advice, because most travelers won't know that alcohol can directly cause 64 diseases not associated with or may occur. That goes from depression to epilepsy to earlier onset dementia to skin cancers to heart attacks to bowel cancers to liver disease to kidney failure to excess bleeding and bruising. And by having individual consultation with a traveler, we find that when one takes the time to discuss these topics in detail, most travelers' behavior is going to be modified. But it's a significant global problem, and it will take time to change the culture. And I'm very grateful for the question, because I think we need to address this collectively as medical professionals, employers, travelers, and insurance companies, because that really will enhance the resilience of the business traveler.
Okay. Another question. Does the new ISL travel risk standard cover traveler health?
So I am not familiar with the ISL. Is it ESL or ISL? If it is ESL, it's a more sort of generic question, and it doesn't really help with the particular aspect we're looking in occupational travel health, because it's not focused enough, it's too generic. I hope I
Okay.
have understood the question correctly. I was referring to ESL.
No, no worries at all. Have you changed your travel health advice since the pandemic?
Yes, we've changed our travel health advice in recommending that all businesses have a business health resilience strategy to review which employees are suitable for travel based on their COVID vulnerability, which we can get from doing an individual pre-travel health assessment, so that a business can decide and publish in advance that people who are at low or moderate risk may travel, but people who are at high risk may not travel. So it becomes a very transparent program, and then conduct individual confidential travel risk health assessment that will mitigate against a lot of problems in the future. And it has also really highlighted that whilst health information has become more public property during the pandemic because of the sharing of vaccination status or recovery status for COVID, it's also really highlighted the need to treat any health problem confidentially, because it really can impact an employee's perception of their work, or how their work perceives them if they feel that they're not well. So on the one hand, a thorough health risk assessment, and on the other hand, a review of how the interaction works between the traveler, the human resources department, the health and safety department, the travel department, and the security department in a business that organizes business travel. And my last point to the question is that the need for ongoing psychological support is something I think the whole globe has become aware of. And I would now always suggest that as a standard for any travel package.
Okay. It looks like that is all the time that we have for questions today. Please join me in thanking Dr. Julianne Gause for her great presentation, as well as our sponsor, Everbridge. If you do have any additional questions or comments, please don't hesitate to click the email us button on the console. Please also visit securitymagazine.com for the archive of this presentation, which will be available for a year. And you can visit there for other information about upcoming events. We appreciate your time and hope that you have found this webinar to be a valuable experience.